Hey y'all, welcome back to my channel. If you haven't been here before, my name is Julie and I primarily make content surrounding topics such as mental health, makeup, as well as music. And for today's video, this is part of my Let's Get Clinical series in which I educate you on various mental health conditions that are described in the DSM. The DSM is this handy book right here. It is the Diagnostic and Statistical Manual of Mental Disorders. This is the most current version from 2013 if you are not familiar with it, and this is what mental health clinicians use to diagnose their clients with mental health conditions. I'd also like to say I feel highly qualified to film this video today as I now have my master's degree in counseling psychology. But enough about me, let's move forward. So the formatting of these videos is typically that I introduce you to the delineated symptoms that you must have in order to qualify for a diagnosis in the DSM for a specific condition. Then I move forward into prevalence, and then because we are always recovery focused on this channel, we are going to talk about treatment options. The last few videos that I have filmed have been in regard to various personality disorders, and I want to keep going with that. My last video was on dependent personality disorder, and today I'm going to be talking about avoidant personality disorder. So avoidant personality disorder is classified as a cluster C personality disorder in the DSM. Cluster C personality disorders are characterized as anxious or fearful personality disorders. Dependent personality disorder is also in this category. The diagnostic criteria specific to avoidant personality disorder describes a pervasive pattern of social inhibition, feelings of inadequacy, as well as hypersensitivity to negative evaluation, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. So there are 7 possible symptoms listed here, and you must meet 4 of them in order to qualify for diagnosis. These include 1. Avoids occupational activities that involve significant interpersonal contact because of fear, criticism, disapproval, or rejection. So occupational is exactly what it sounds like. It's related to work. So individuals with this condition are going to struggle to work since they struggle immensely to socialize with others. Number 2, they are unwilling to get involved with people unless they are certain they will be liked by that person. 3, shows restraint within intimate relationships because of the fear of being shamed or ridiculed. 4, is preoccupied with being criticized or rejected in social situations. 5, is inhibited in new interpersonal situations because of feelings of inadequacy. So that's just fancy terms for these individuals struggle in interpersonal situations, whether that is a relationship they're in, a relationship they're building, but especially when they're meeting new people, they are terrified of being criticized because they struggle with a severe feeling of being inadequate. Symptom 6, views self as socially inept, personally unappealing, or even inferior to others. And finally, 7, is unusually reluctant to take personal risks or to engage in any new activity because they may prove embarrassing. Now, I know what you're thinking. A lot of these symptoms do have overlap with social anxiety. The aspect of this is that a lot of individuals with this mental health condition also comorbidly have social anxiety disorder, which is now referred to as social phobia. But the point is, this is a personality disorder. So this is a lot bigger than someone who solely is dealing with social anxiety. This is impacting someone's functioning. They can't sustain relationships. They can't maintain a job. It's really getting to them. And not to negate social anxiety, because that is something I have, it does not run as deep as this condition as I described it. So according to the diagnostic features section in the DSM, which delves into a little more detail on this mental health condition, for individuals with this specific condition, their personality tends to be that they are shy, quiet, inhibited. Some may even describe them as feeling invisible because these individuals specifically fear attention being on them because they're worried and overly concerned that the attention will be degrading. And feelings of inadequacy for this population are specifically tied into experiencing low self-esteem. Moving forward into common comorbidities. So these are mental health conditions that often exist alongside avoidant personality disorder. we have depressive, bipolar, and even anxiety disorders, as I previously said, especially social anxiety. This condition, since it is a cluster C personality disorder, also tends to be common with other cluster C personality disorders, specifically dependent personality disorder, which makes sense since these individuals tend to become dependent on whoever their caregivers are because they most likely have very few relationships due to their social inhibition. Other comorbidities include borderline personality disorder, as well as cluster A personality disorders, which include paranoid, schizoid, and schizotypal personality disorder. So that's as much as I could really find out there about avoidant personality disorder. I'm going to move forward into prevalence rates as well as treatment. So according to the DSM, and again, this was published in 2013, there was a epidemiological survey on alcohol and related conditions taken between 2001 to 2002, which suggested a 2.4% prevalence rate for avoidant personality disorder at the time. However, I did find a scholarly article that other evidence out there suggests a prevalence rate more so around 1.5 to 2.5% of the population. There are also minimal gender differences present in diagnosing this condition. In some research, it shows it is more common in men and women, but it is not unanimous across the board. Moving forward into treatment options. So treatment options for individuals with personality disorders. Typically, medication and some form of therapy, just like any other condition. However, medication is not the most effective treatment option for personality disorders. If the individual with avoidant personality disorder has a comorbid depressive or anxiety disorder, especially social anxiety, they may benefit from SSRIs, antidepressants, what have you. But because this is such a pervasive pattern of behavior in their lives and the behavior needs to be broken, this is why these individuals can benefit from therapy where they sit down and examine their thoughts and feelings and explore their identities, self-esteem, etc. So some treatment options for this population that may prove helpful are CBT, which is fairly standard. It makes sense. We address our thoughts, feelings, and behaviors and how they're all interrelated in hopes of correcting our maladaptive behavioral patterns. We also have psychodynamic therapy, as these individuals may have experienced certain traumatic events or situations in their childhood that they don't even realize are affecting their behaviors and thoughts and feelings to this day. Beyond this, if the individual has social anxiety disorder, we know for phobias, exposure therapy is one of the best treatment options. So this may be a viable option if that is a comorbid condition for an individual. Some individuals may also benefit from social skills training, and a few studies have noted emotion-focused therapy as well as ACT, which is acceptance and commitment therapy. I don't know a ton about ACT, but it has to do mainly with acting according to your values. So an individual with this condition may struggle to identify what their values are because they are lacking independence, similarly to individuals with dependent personality disorder. That's all I have for you today. This was a short and sweet video on avoidant personality disorder. I hope it was helpful. If you have any more information to add or you want to ask me a question, please feel free to leave it down in the comments. I'd love for you to give this video a like and for you to subscribe to my channel as well. You can follow me on all my social medias. Let's just throw them down here. My Instagram is Julie_counseling. My Twitter is Julie Counseling with no underscore. My coaching Instagram, as I am now a certified personal trainer, is Julie_coaching, and my Facebook page will be linked down below in the description as well. And I'll catch you on the flip side. Bye, guys.